Good afternoon, everybody, and thank you for joining us for one of the last sessions of today at the U.S. Chamber of Commerce Foundation Public-Private Partnerships Conference, the ninth annual, in fact. My name is Marcus Coleman. So glad to be here with you today, joined by four wonderful panelists, and looking forward to having a conversation on something that we've been talking about often among each other and among the network: acting on faith in times of crisis. I know many of you have heard various presentations that have looked at the different organizations and perspectives to help promote equity and resilience and equity and disasters, hoping that this conversation builds a little bit of what we heard from Jackie Patterson and Leslie Luke, who presented earlier today during one of the keynote sessions. Also from Monica Sanders and others who have talked a little bit about how we should rethink about equity and think about equity and disasters as well. So before we get started with the full presentation, I want to provide an opportunity to introduce our distinguished guests and panelists. So what we'll do is we'll do a quick round robin. If each panelist can provide their name, organization, and one partnership that they are particularly excited about, that they think is, or that they feel is creating the world, or helping to, change the world for good. And so again, your name, organization, and a particular partnership of interest that you see changing the world for good. And we'll start with Kanaya.
Hi, my name is Kanaya Hardy. I am a program analyst at Healthcare Ready, and we are a nonprofit that focuses on supporting the healthcare system in times of disaster. And so partnership is really at the heart of our mission. And so there are really many partnerships I'd love to highlight. But one thing I'll spotlight: recently, we partnered with Project Hope to deliver masks to healthcare workers around the country, Project Hope as well as Business Roundtable. So a really great example of a public-private partnership that I think is changing the world for good.
Excellent. All right, Charles, how about yourself?
All right, hi there, everyone. I'm Charles Ellison. I'm principal founder of BE Strategy based in Washington, D.C., but also I am a talk show host, executive producer, host of a daily public affairs program, Reality Check, on WURD Radio, which is based in Philadelphia, but airs nationally through a number of live streams, and also a senior fellow for the Council of State Governments Eastern Regional Conference Council on Communities of Color. So I've been seeing a number of great public-private partnerships activated through these very difficult, uncertain times, from a lot of collaborative work that I've been seeing in my capacity as senior fellow with the Council of State Governments, Council on Communities of Color, and linking up a lot of the state legislators under our umbrella, particularly Black state legislators, with organizations like Healthcare Ready. We've seen some fruits yielded from that, to also working with, I serve on a national advisory board for a major nonprofit public school network that's based out in California. They also have schools in Michigan and Ohio as well, and teaming them up or lining them up with historically Black colleges and universities. And so we're working through the pandemic as well, and trying to yield some benefits for high school age students, and trying to help them through these very difficult, rough, uncertain times. And also college students as well. So been seeing a lot of interesting public-private partnership activity out there, and very much looking forward to the discussion.
Thank you very much, Charles. And Kent, how about yourself?
Thanks, Marcus, and hello, everybody. Yes, my name is Kent Annan. I am Director of Humanitarian and Disaster Leadership at the Humanitarian Disaster Institute, which is housed at Wheaton College, and really grateful to be here with you. One of the main partnerships we've had in the last 4 months has been with the National Association of Evangelicals. It was a really great partnership where they have a network of dozens of church denominations around the country, and we had expertise in being able to respond to disasters like COVID-19. And so to be able to work together to do an ongoing webinar, to launch a website called reopeningthechurch.com, and to produce and distribute materials like one that Marcus was a co-author on, that helped the Black church navigate COVID and responding to racism at the same time. So we've been really grateful as an institute to be able to have partnerships like this during this crisis.
Excellent. And so a little bit about myself. My name is Marcus Coleman, Senior Associate for HWC, and we do believe in changing the world for good. We do that in a few different ways alongside partners in the federal government space, but also continuing to find ways to work alongside wonderful organizations such as those mentioned here today. So glad to have you all with us for the conversation. So before we get into the full discussion, I just kind of wanted to provide some context for folks. I know that we are at a public-private partnerships conference for the U.S. Chamber of Commerce Foundation. We have a lot of business leaders, emergency managers, but I know one of the co-hosting organizations is also the National Voluntary Organizations Active in Disasters. Many of you may be familiar with that organization's work. For those who are not, it's a wonderful organization that's comprised of, actually, it's a membership-based organization that's comprised of more than 100 national and state partners, many of whom are actually faith-based. And so part of the reason why we wanted to bring this conversation to leaders today, you may be in one of three categories. One category may be, hey, listen, we may do some work through charity that gets to faith-based organizations and ultimately does good in the world. The other determination may be, well, we actually consider partnerships to be a key part of our businesses or our company's mission. And so we're looking for new opportunities to engage with current partners or existing partners in a different way. The third bucket may be, we're all in. This may be a part of our very core to what our organization does. Maybe not through the aspect of the partnership piece, but maybe a particular service you provide works directly with faith-based organizations, or you may identify yourself as a faith-based business. So we wanted to just set the stage here. What you're looking at with this pie chart is it provides just some demographic information on the religious landscape of the United States as of 2016. Some notable things that you'll see here immediately, there's this big purple chunk, which is called unaffiliated. Now, just to clarify for the context of the research and for this conversation, when we're talking about people who are unaffiliated, that is not the same as people who aren't just don't believe in religion or spirituality in any context. Some people may be considered seeking, which means that maybe, they don't affiliate with the traditional religion, but they're continuing to explore and have curiosity. Some people may be humanist, right, which is not religiously based, but very much rooted in principles and values. And then, of course, you do have people that are non-believers as well. The key thing is, right, one of the demographics is about 79% of Americans identify with some form of religion, which I think you see a little bit of this here. And so you see this broader chunk of just the different type of faiths that comprise the United States. Second piece, don't want to belabor this point too much, but this actually provides just some stratified information by age. And so there's some trends that you may have seen different headlines, whether your publication of choice is the Wall Street Journal, the Washington Times, the Washington Post, or the New York Times. You'll find different articles every now and again that talks about just the changing demographics as it relates to religion in American society. And so when we're thinking about some of those changes, here's an example of what that looks like by age bracket. Point out again, I think some things that are anecdotal to some of the headlines. Among the younger demographic, there's a sizable chunk that considers themselves unaffiliated. The older you get, the more you find folks identifying with a particular religion. Some things to point out, though, is there's some categories in particular where there may not be as much variation or change between age demographics. And for some, it stays pretty constant as you're looking at that here. And so this is research that's available through PRI. So why do we bring this up in this case? Many of your employers, many of the partners, the community members that you were seeking to serve either as customers or through your corporate social responsibility work may be identified or connected to a facility of faith. And so we just want to make sure that you kind of have that context going into it. Two more data points and then we'll get into the conversation. It is still the case. I know that there's a lot of headlines that talk about faith in politics, faith in the public square, faith in a lot of different contexts, but ultimately it's still the case that most Americans believe that that religion is a force of good in society. And so this is some research that we have collected from the Pew Research Center, which does various surveys. And we know that that's particularly important in times of disaster and of crisis. And so we find ourselves in crisis, right? There's a lot of challenges that we are continuing to face since we are in a pandemic. But for other crises, the natural disasters, the man-made disasters, some of the other issues, we find time and again that the faith community is a force for good in preparing, responding to, and recovering from hazards. And we know that to be true for three reasons. And so we think about the presence of the faith community. So I know that there have been some other panels, and we have partners from the national VOAD community participating on panels throughout the course of this conference, and we have the partnership day coming up as well. That presence of the faith community is felt not just for the spiritual care, but for some of the emotional care as well. And then we're thinking about some of the tangential things that happen in emergency management, specifically when we're thinking about emergency support function 6 with mass care. So we're talking about feeding. Here you see a graphic or a visual of the Sikh community partnering with the Red Cross, providing meals to people after a wildfire. You see it through their generosity. You have Islamic Relief, which is in the bottom right of the screen. And there you see them participating in a rebuilding effort in support of disaster survivors. A little bit about this particular photo: the Islamic Relief USA actually partnered with the United Methodist Church as well to do some of this work in the South Carolina area. And then, of course, we have the partnership. And so you have the visual of what people typically think about when they're thinking about the contributions of the faith community, right? You have volunteers at a house of worship doing work in the community, oftentimes off of maybe some donations and some investment. But what I want you all to think about as business leaders, and what we want to share with you, the final data point, is when we think about the socioeconomic contributions of religion to American society, the total socioeconomic contributions is at about $1.2 trillion every year. So we've seen a lot of legislation for a lot of money. And this is an example of what the contribution of, again, religion to American society, when we're thinking about the aggregate socioeconomic contributions. Now, to be clear, this is not just in terms of dollars, right? This is in terms of donations. This is in terms of hours. This is in terms of a lot of other factors that kind of go into making that broader socioeconomic contribution. And this is a data point that was researched and developed by an organization by the name of Faith Counts. And so on the surface, when we think about $1.2 trillion and when we're thinking about what the role is of the faith community in disasters, I know typically people go to congregations, but the last piece of it is it's actually much more than that. And so as you notice, this is a breakdown of what that $2.2 trillion is each year to our economy and to society, and where the contributions are coming from. And so congregations and the congregants in the houses of worship definitely comprise a sizable chunk of those contributions, but there's a bigger chunk, and that's coming from the business community. So for faith-based organizations, we know that they are employers as well. They employ people. They work with vendors. They work with suppliers, in addition to doing some of their partnership work that they may do in other aspects. And then institutions. And so many of you, your school when you were younger, or maybe when you went to college, or maybe the hospital that you go to where your doctor is, may identify or consider themselves faith-based. And so if you're interested in receiving this data, we'll be happy to provide this information to anyone that's interested. We'll have the emails at the end to kind of get a deeper dive into what this research looks like. The other piece about businesses, when we talk about businesses, we want to think about some of the media footprint and imprint as well. And so here we're talking radio stations, TV, radio stations, things like that. And so what we want to pivot to with that foundation being set now is how business leaders, community leaders can work with the faith community, but want to also expand it to community-based organizations as well that are acting in good faith to meet the needs and help people before, during, and after disasters. I could talk for the next hour, not going to do that. Actually going to open it up to a conversation with the panelists to kind of talk a little bit more about how they are acting on faith in times of crisis, and hopefully providing you all with some key themes to consider as you are building your partnerships with community-based organizations, and potentially after this presentation, some faith-based organizations as well. So the first two themes kind of go together. It's humility and transparency. And so the great Jim Collins, author of the book Good to Great, talks often about level 5 leadership. So that's the whole premise of the book. One of the key principles is being a level 5 leader. Personally, I found it to be true that level 5 leaders have some traits in common, and those are humility and transparency. It is also the case that in the context of this disaster or this crisis that we find ourselves in, being humble enough to admit that we don't know what we don't know, and looking for partners to help us explore and learn a bit more, and being transparent enough to share information when we can continues to be critical capital to build trust in times of crisis, but also to build trust in thinking through who are good partners for recovery. There has been a lot of information, some of it credible, some of it not, and people are going to their various trusted sources. Want to raise up these two themes because what some of the Edelman research showed early on in the pandemic in 2020 is that the most trusted source for many people, according to a poll that they conducted, was actually their employer. And so as business leaders and as communities and as small business owners, I know many of your stakeholders or maybe your organization, definitely organizations across the board, all ended up in this space of we want to be able to communicate clear and concise information, provide updates when we receive them, be transparent about our position, but also make sure that we're mindful and act with humility, that we're not overestimating or being too overly optimistic or pessimistic. So we're going to continue to look to the experts, look to the data, look to some of the trusted leaders. And that actually leads me to the first case study that I want to talk about. When we look at humility and transparency from a community-based perspective, I want to bring in Charles here. So Charles, through his work with the Council on State Governments Eastern Regional Conference Council on Communities of Color, has led a wonderful effort through the micro summits model that I'm going to ask him about. And it's been a way to be humble about bringing in the right experts and transparent to make sure that people are providing the right information. And so, Charles, I just want to toss it to you kind of for the first question. How have you adjusted the communications and what are you learning? And how are you promoting engagement and dialogue through this micro summit model and not debate?
Right. No, thanks so much, Marcus. Wonderful presentation, wonderful introduction, and some really essential insights there too. I think that one data point, I think where you were showing like that the religious community contributes about $1.2 trillion to the overall economy. I mean, that's over 5% of national GDP. That's significant. So I definitely think that shouldn't fall on deaf ears, and organizations, corporations, companies should pay very close attention to that. But I personally have not had to make much of an adjustment in terms of this pandemic environment, virtual communications climate that we're in, because I've always operated quite virtually. I'm quite pleased that now everyone understands that it's not so bad. So, in fact, it forces you to stay in place and get things done. Although suddenly we're finding we have lots of time to do other things, but sometimes we find out we're running out of time. But the micro summits came out of that, came out of me having to, already operating virtually and operating remotely, particularly running on an almost daily basis, the WURD radio show, doing a lot of remote pop-up broadcasts from Washington, D.C. into Philly, reaching out to Philly region audience and also a national audience as well through the live stream. And so it seemed like there was this natural movement or migration towards doing these micro summits and utilizing platforms like Zoom, like what we're on right now, because the CSG found itself in quite a pickle and also quite frustrated because it had planned on these very important essential discussions about a number of major issues. We saw a lot of major issues, policy issues that have been popping up over the past couple of years, particularly as it related to communities of color, particularly Black people. We had been touching on a lot of issues that are coming out now in this big social justice moment we see right now. We had already been having conversations and crafting policy, actually convening with state legislators in a number of states, trying to craft out policy on issues like, for example, false 911 calls or racialized 911 calls in public spaces. We as CSG East have been working on that and working and crafting out legislation in a number of state capitals for a while before that ended, before we saw that big moment in Central Park, right? But so we figured this, we needed to start some kind of conversation and create some momentum, hence the micro summits, because we were seeing a number of people holding virtual conferences and we just fell into it naturally. And we're able to even through that, create a playbook for very intentional, and also not too long, bite size or sound bite size, but very important informative discussions. That's why we call them micro summits, where we also, we keep them transparent and open to the public. We provide an opportunity for the public to see these very important conversations being led by a mix of state legislators, also by folks in the nonprofit sector, but also folks in the private sector as well. And really the whole goal there, we also found an opportunity in setting up micro summits and utilizing the virtual environment to connect the grass tops, kind of that grass tops influencer community, whether those are legislators or policymakers or people who are leaders in their respective organizations, connecting the grass tops with the grassroots so that they could collaborate more on these important issues. So we've seen great success with that micro summit model. They've been happening at a pace of about, we took a little bit of a break in June because we were doing these at a clip of about every couple of weeks. And it's a big effort to have these hour and a half long conversations, 4 or 5 panelists. There's a lot of effort that goes in, production that goes into it, but able to take the micro summits. And so I'm on a number of other local, regional, national media platforms, and I was able to share that to a broader, bigger audience, those recorded conversations as well. So we've had a lot of success with that. And people also feel we're feeling more connected to their policymakers. That was important.
Yeah.
So then last point here, it was taking the discussions and then transforming them into action. So we've had instances now with those discussions, those micro summits, they are now, as we speak, in the process of being molded into actual policy in respective state legislatures within our conference.
Wow, that's excellent, man. And I know, so Charles, and when he talks about state legislatures, I think another point to note is we're going to often find that some state legislators are actually faith leaders themselves.
Right.
And so when we're having some of these conversations, it's important to think about the role that the faith community has, even in the policy space, because they may be actual policy makers in addition to some of their other community duties and responsibilities. I appreciate that breakdown, Charles.
Yeah.
Charles, I know that part of some of the micro summits, right? I know they were powered by Healthcare Ready. There was some partnership there because there were some particular questions that were coming up that leaned a little bit too uncertain for everybody. So we have to bring in the public health experts. If you could talk a little bit about, Charles, your partnership with Healthcare Ready, and then after you chime in there, Kanaya, I'll bring you in to talk a little bit about how Healthcare Ready has seen these conversations as beneficial through the micro summit model.
Yeah, that was very important. And another thing too is the micro summits made partnerships or partner collaborations a lot more easier because it's just operationally it's plug and play, and so that makes the partnerships much simple, less complex. Obviously, we're all kind of at home. We have to stay at home, and so it also forces us to focus on the fundamentals of that partnership and the goals that we're trying to reach, the mission, right? And we're not so focused on, the administrative or back end operations, when we're kind of in this pandemic environment. So it sucks that we're all having to be at home and confined to spaces. But the upside was that, we're focused on the mission. And so the partnership with Healthcare Ready was extremely important. It was real crucial because you had a lot of state legislators in key states that were already, like states like New York, New Jersey, for example, especially New York. And the chair of the Council on Communities of Color is State Senator Kevin Parker, and he's in Brooklyn. He represents Brooklyn. Brooklyn was like the epicenter of New York City, which is the epicenter, which was at one point the coronavirus epicenter for the planet, right? And so he's already going through a highly stressful situation. He had lost friends, family, colleagues to COVID-19, but a lot of legislators, particularly in those highly impacted Black communities, were absolutely kind of either at their wits' end or scared because they were just scrambling for resources, well, both resources and guidance, good, credible public health guidance. And Healthcare Ready brought that to the table. And so we were able to form those relationships and then, show other Black state legislators in highly impacted communities in other states hey, not all is lost. We have this frontline public health organization that that knows public health best practices, and they can help guide you through this. They can even identify or locate critical personal protective equipment, resources, or medical gear, or where you can find also crucial pharmaceuticals or crucial essential medicines for people who are already suffering from chronic diseases amid pandemic. So that was a relief for a lot of Healthcare Ready. I don't think really truly even itself realizes how really helpful and relieving that was for a lot of legislators. There's still a lot of work to do, but the micro summits helped also help kind of crystallize that relationship a little bit more, make it more formal, and so now people know, particularly those legislators who are representing those highly impacted, disproportionately impacted communities. Hey, we've got a partner that we can go to, that we can rely on.
Absolutely. Well, thank you for that, Charles. And so, Kanaya, we know that many leaders of organizations, so business leaders, faith leaders, as Charles mentioned, leaders in the policymaking space, uncertainty brings anxiety. And we know that there's not just the anxieties of the leaders themselves, but also the people that they lead. Kanaya, I wanted to know if you can talk a little bit about if there's a particular topic or micro summit that you were a part of, or a member or an organization that you communicated with, that you think would be helpful for some of the folks, some of the audience members to think about in terms of what kind of conversation should people be having with employees and with other organizations at this point, and how can Healthcare Ready provide tools and resources to help them with that?
Certainly. So there were a lot of conversations had throughout the Micro Summit series that I think are incredibly important. And Healthcare Ready sitting at the intersection of public health, emergency management, and the healthcare system and the NGO world, public-private partnerships are really at the heart of what we do. And we find ourselves facilitating and convening this often. And one of the things, the themes and the insights that we're able to glean in all of these different interactions and engagements is the need for information sharing and the need for clear and trusted information to be brought to the forefront in every situation. Because of course, all of the anxiety that is caused by a disaster is oftentimes increased by the overwhelming amount of information. And especially now, as we're seeing in a global crisis, there's information coming from all ends, and there's perspectives and opinions, and a lot of politics that get in the way sometimes of people just understanding how they support their employees, their communities, and protect themselves in a time of a crisis. And we look really heavily at those with chronic conditions and those with medical needs as a very critical population with a lot of vulnerabilities. And so we know information sharing is sometimes the difference between someone being able to access the healthcare system, being able to access their medications, is really a useful tool to assuage some of that anxiety. So really just emphasizing the conversation we had about crisis communications and the need to really stay on top of your situational awareness. Healthcare Ready puts out situation reports, and we have a resource page, and we stand up websites for disasters as they come. So we have a COVID page that's being updated regularly, and a COVID resources page, and a patient resources page. So really, as much as we're trying to collate, collect, and sift through all the information out there and get it to people in the most clear and trusted way.
Excellent, Kanaya. So that actually brings us to our next theme. So one of the other things that we find often when faced with a crisis is that you're working through a lot of tensions. I think we've heard already, right? We're experiencing and we're hearing tensions about what does it mean to reopen? How do we think about what our posture is going to be, not just in the context of this pandemic, but the other crises to come? And the concept that I invite you to consider actually comes from another business writer. His name is Roger Martin. He wrote a few books. One of his books was called The Originals. I think that's the book that many people know, but he coined the concept integrative thinking. And this kind of lays out what that process looks like from a conventional thinker, just thinking about kind of what's relevant, to somebody who's integrative thinker, which is looking at some of the tensions that are happening and trying to formulate or work through a problem solving process to find solutions that speak directly to the needs of a particular community. Kanaya, I want to stay with you for this part. So one of the things that Healthcare Ready does do is you guys do sift through a lot of information. And I know that you all have sat at the intersection and the different tension points between the private sector, the public sector, private and community-based and faith-based organizations. The question I have for you is, what have you learned, or how has your understanding of the problem kind of matured? And if you can speak a little bit to what are some of the things that you are learning from faith-based organizations, or are there particular things that you develop that would be useful to maybe business leaders to provide to faith-based organizations as it relates to kind of just understanding where they can get to some broader solutions to helping taking care of people in their family or in their home?
Yeah, so we have created so many resources throughout this entire response, and particularly for faith-based and community-based organizations. And I have been managing as much as possible the community engagement work stream in our response. And so one of the things that I've noticed, and we've noticed in many responses, but especially during COVID, is the criticality of really connecting with trusted stakeholders and trusted leaders in a community. Because if you're a stranger coming in to try and share information, as much as you may have expertise and may be in a lot of conversations with information that's really important and trusted, it's not really going to reach people the way it needs to if it's not coming through the channel of organizations and institutions that they're already interacting with in their day-to-day lives. So during a disaster, people aren't really necessarily trying to make new partnerships and make new friends. They're basically trying to rely on their instincts and who they know they can trust. So that's why the partnerships with faith-based organizations and community organizations, those doing on the ground work, volunteers, leaders that are in positions that may not be, codified emergency managers, but are oftentimes doing disaster recovery and resilience efforts. Those are incredibly important to really reaching people and really getting them to be a part of, the community response. And so to highlight the resources page, we've made a lot of tip sheets and FAQ documents, or FAQ websites, I should say, to break down some of the questions we've gotten in our outreach with either former trusted partners or former community partners we've worked with, such as the resiliency hubs in Baltimore, and the questions we've gotten through their work in being, food distribution sources and food distribution sites in the city. It's really important for us to be able to hear the needs, hear the issues that they're dealing with, and kind of collate that and collect it and sift through it and push out resources that can help other partners and those who are trying to support these community-based organizations.
Thank you for that, Kanaya. And I know one of the things that we talked about very early on during the pandemic is that we had looked at that overlap between the medically fragile and the socially vulnerable, and kind of use that as a space where can we provide solutions that help meet the needs of them at the individual and at the family level. And one of the things that I know you've all looked to is working with faith-based and community-based organizations. Kent, I want to kick that part over to you a little bit, is when we're talking about the tensions of how the faith community and the church is showing up for those that are medically fragile and socially vulnerable. What have you seen? What have you heard? Like, kind of what are you learning, or how are you rethinking about the role of the church and the role of the faith community as we're thinking about kind of the next phase of solutions for families? Or maybe we're not at the next phase for many families, right? They can still be struggling with things that they were struggling with pre-pandemic. But welcome your thoughts on just kind of how you and Wheaton are continuing to kind of think about the tensions that are at play in times of crisis.
Thanks, Marcus. I've loved learning from both Kanaya and Charles, and we've worked pretty closely with Healthcare Ready along the way. A couple of things, worked with Dr. Lucent on a couple of manuals. So it really builds on what's already been said here. And what we've seen in this tension is it's really helpful to have clear communication. I think we've seen when churches have positively responded, this goes to your opening, Marcus, that there's been a real approach of humility, that churches are going into this as learners, not as people who know exactly what to do in this situation. And then I think another example I've seen of churches doing this really well, responding well, is when they are relying on internal expertise. So do they have healthcare professionals in, logistic professionals, leadership, someone from local government inside their communities? And if they're leaning on those expertise, and then they're looking to outside experts, are they getting in touch with public health officials? Are they reaching out to other organizations that can give them the expertise that they want? And then if they're continuing in a posture of learning along the way and assessing needs. So some specific examples I've seen is a lot of churches around the country that have responded well to seeking out vulnerable populations early. So my colleague, Dr. Jamie Ayton, and I, he's a psychologist and he's been in disaster response for 15 years. And what we did in our early manuals for churches was, as you close down, don't let people fall through the gaps. And I think overall, we've seen a lot of churches making efforts to be on the phone, think about vulnerable populations within their own community, older adults, maybe they aren't on email all the time, how are they reaching to them? And then also vulnerable populations in their community. Is there a nearby refugee community that might have language issues to get access to the most important recent information? And so for us, it's really been encouraging bringing together integrative thinking. So we're working as an institute with experts in different subject matters, encouraging churches to use reliable information and rely on expertise within and outside of their community, and then to especially pay attention to vulnerable people in their own faith community and in the local neighborhoods. And I think when churches are doing that, we're seeing, there's lots of work to do and there's lots of learning to do, but we've also seen a lot of real impressive results where churches aren't just worrying about worship, and that's taking them a ton of effort, for example, or other faith communities to take worship online, but they're doing much more than that, and we've really been encouraging them to do that along the way.
Thank you for that, and I appreciate you, Ken, the work that Wheaton continues to lead out on, and trying to create some spaces, right, to find new ways for folks to build trust. So I know one of the questions that we received are about some of the book titles and information that we shared. We will have that available afterwards. I'll leave my email address if you guys want to email me directly. We'll probably end up posting some of this information as well on my company blog site also. And so with that, let's move on to the next topic. So again, I think with crisis, we have crisis, which brings uncertainty. It brings ambiguity. There's a lot of complexity. And there's a lot of volatility. So for those in the emergency management space, we talk about VUCA environments often, right? Volatility, uncertainty, complexity, ambiguity. And it's often hard to think about what strengths you have in those moments, particularly when the duration of a response is going as long as this particular response has. And you're thinking about how we are building resilience for the next thing that may be coming down the pike. One of the tools that I know many faith leaders use, and they may call it something different according to their faith, but something that definitely resonates in the business community, is this idea of appreciative inquiry. In emergency management, one of the things that I've been trained up in, thanks to Jana Scott, is making sure that we take an assets-based approach. And so you see the graphic here that kind of encapsulates what appreciative inquiry is all about, which is being able to use a set of principles and a set of ideas to look at the assets that you have, as opposed to thinking about what's missing. We've seen tremendous innovation in times of volatility. I think we've seen people that had never used Zoom before use Zoom for all kinds of reasons. Facebook Live, I know, has gotten a lot of play in different ways. And I think we're reorienting ourselves, right? We're finding we are definitely not in a normal of any type at this point, but we are finding that there's going to be some tools and things that we can take away based on the assets, not just within our organizations, but from working with broader communities that we can take forward into whatever the next normal looks like. And so, Kent, want to stay with you on this point of thinking about appreciative inquiry. One of the key questions that I know we ask, and that I know Wheaton has been asking and living out a little bit, is how can we make others around us a success? And so we typically know, right, business leaders, community leaders, government officials, they're coming to the faith community because they want to be successful in helping their members of the community, their friends, their family, their loved one, navigate that process post-disaster. If you can talk a little bit more, Ken, about kind of how Wheaton HDI thinks about making others around them a success, and if there's any particular stories where you've seen partnerships result in something successful at this time, would love to hear more about that.
Yes, thanks, Marcus. One of the ways we seek to, as an institute, make others a success is doing years worth of research and then being able to deliver those results in a bite-sized way, so even in a one-page summary. So one example of a partnership is with a National Association of Nurses around the country, and they saw what we were doing with churches, and they said, hey, a lot of your information could actually be helpful for our nurses who are undergoing this stress. And so we shared and adapted slightly some resources we had on self-care, and caring emotionally and spiritually for others, and to adapt that slightly and make it available for that network of nurses. This is an example of kind of serving the health sector through the work we do. Another example for us, which goes to this asset-based or appreciative inquiry that you're talking about, is we developed it's been researched for about 10 years that we kind of did a final scramble to put out during COVID on spiritual first aid. So we have a site called spiritualfirstaidhub.com, and this is a booklet about 40 pages long on how to provide spiritual and emotional care from peer to peer. So it doesn't take an expert, peer to peer, to help others. And so it's been used in churches around the country and around the world. But what's been really great is we've also had a number of businesses coming to us. So everything from small shops to say our employees are going through difficult times, we really see this could be a valuable tool to give some just really basic peer-to-peer spiritual and emotional care in crisis. And research shows that can make a long-term difference in people's health and resiliency. And we've also had some larger companies, sort of Fortune 1000 companies, come, and we're talking about doing training with them. So for us, we want others to be a success, and part of how we do that is by doing research and then creating these hubs like spiritualfirstaidhub.com and reopeningthechurch.com, and these different hubs so that people can come and find what they need in a way that they can then turn into action to serve others.
Thank you for that, Ken. And I know that there's the graphic here at the bottom. Can you talk a little bit about, so we know many leaders, regardless of the type of organization you lead, it could be a small business, it can be a church of any size or a house of worship of any size. Can you talk a little bit about what this graphic represents at the bottom here in terms of the 4 questions and kind of how you've all been having ongoing conversations about reopening facilities, specifically, I know the church for you all?
Yes, we've been like Healthcare Ready. We've been producing lots of materials. We produced a kind of how to prepare for COVID, and then we had a manual on how to respond with spiritual and emotional care during. Then we thought, churches, as hard as those first stages, those first months where this reopening is in some ways going to be even more challenging than anything we've faced yet. So we put out a manual on how to reopen your church that relied on public health information, psychological, spiritual insights, as well as logistics. And then one of the things we realized, is we want to turn this into something that's really can be bite-sized. So then in that manual, we have some decision trees. So is your church and family, is the church ready? So we have a church kind of walk through these steps, 4 different steps of making sure they're well prepared, using the most recent information that's available from science, as well as being grounded in their own faith, their own theology. And then we also created, similar to this, what you're showing here, Marcus, we created a decision tree for families and individuals, realizing, okay, the church is deciding on reopening, but then every single individual, every single family has different factors, risk factors that they need to take into consideration. So what we're trying to do is provide these kind of tools, and I think many of them could be adapted and useful for businesses in this time, tip sheets on how to speak with older adults, how to speak with children, these things that come across faith communities and business communities, so that we can provide ways to think things through wisely and safely, but without without being fearful, but with being wise.
Excellent. Thank you for that. Charles, you are somebody that I have known and grown to know to be very wise and provide counsel for a lot of people as well. And what I appreciate about the interviews that you do, both in the pure communication setting, but also kind of in the engagement space, is you're all about having people kind of reframe what's happening and think about some of the assets. Don't know if you have anything else you want to add in terms of just what business leaders or what you would encourage leaders to think about when they're looking at this question, right? How can we make others around us successful, and how can we make others around us a success?
There's some thoughts with respect to that question in the faith institution context, Marcus. And thank you for those kind words. I appreciate you. You're gonna make me blush here, but it's really been a pleasure working with you and Kanaya and Healthcare Ready. You all have done a tremendous job and continuing to do so through some really difficult circumstances. So really appreciate that. And also Nicolette, Dr. Lewis Saint has been doing a wonderful job as well. She's been coming on my program every Monday, and that's been a very useful exercise and a very relieving and edifying exercise for a lot of listeners. I get a lot of great positive feedback about that. But on faith institutions, I think one thing I think that business leaders should understand is that, look, when you're thinking about or considering approaching these institutions, don't just consider them as just churches or synagogues or mosques. These are essential resilience infrastructure. Don't even think about it in terms of the pandemic that we're in right now, right? I mean, this has been the case for generations, for centuries even. These are key central community convening assets, community collaboration, partnership assets, especially when we're talking about the Black community. So, I mean, there are three, for me, like three essential institutions that you should approach at all times when you're looking at collaborating with the larger Black community. I mean, it's the Black elected officials, it's Black media, especially Black radio, like what I'm on every day, because 95% of African Americans trust and rely on Black radio for their information. And it's also Black churches. But don't look at them as just churches. Look at them as resilience infrastructure that can be immediately activated in a lot of cases when these disasters strike. I mean, I saw this to be the case, for example, looking at and touching base with and covering folks in Houston in the wake of Hurricane Harvey. And so one of the most highly impacted sections of Houston was a majority Black section. It was where the Houston Texans Stadium is. And so they didn't have any infrastructure in place to handle a major flood like that or a major hurricane, but they had the churches. And then so suddenly the churches became like warehouses for critical supplies, for critical hygiene needs, critical food. You had a state representative who represented that particular section of Houston able to rely on or lean on the churches as that key essential resilience infrastructure. So it's identifying that key resilience or appreciating that that's key resilience infrastructure. And also in a moment like this, like working with what we've got, sometimes it's not as complicated to create those rapid response or crisis communications frameworks as we think it is. A lot of times those assets are already there, they're in place. It's just that we take those sorts of frameworks or that sort of infrastructure, we take it for granted because we're always using it. And sometimes those key assets, those key mechanisms and tools, they're already right there staring us in the face. We're already using them. Like, for example, Zoom. Zoom was around before the pandemic. Now suddenly it's become like a key tool in us connecting and doing or convening conversations like this, or holding micro summits, or connecting organizations and policymakers with one another so we can, figure out solutions and figure out a way out of this. So I would just leave it on that note, to one, appreciate these institutions as key central resilience infrastructure, and two, working with what we've already got.
Absolutely. No, I appreciate that. And I agree with you that they're working with what we already got and finding those opportunities to connect and build moments of connection. It continues to be critically important. I know one of the questions in the chat talked about spiritual first aid. And so, Ken, if you can share that link one more time, and then we'll be sure, again, to make sure that the information is provided so you know where you can access Kent and access the team that can get you connected to that. So, Kent, do you want to share the website again? Kent may be on mute.
Oh, it's been weeks. It's all
right. Go ahead, Kent. Looks like
here. Yeah, so it's spiritualfirstaid.com is the here, Marcus.
Spiritualfirstaidhub.com. I think I got you. So spiritualfirstaidhub.com. And then again, we'll provide Kent's email at the end as well, so you can access him. So Charles had mentioned a point, and I think Ken spoke to this as well. The last principle that I want to share with you all is the principle of fellowship. And so in the disaster resilience context, some of the research done by Daniel Aldrich, I may not be pronouncing his last name correctly, but he talks a lot about the role of social capital as it relates to building resilience and thinking about some of that social cohesion and how important social cohesion is and the elements that kind of contribute to building social capital. And one of those contributors is fellowship. And so when we think about fellowship, I think for those of you that may be active in your faith, that means a particular thing for you. But here we're literally talking about coming together. I also think about the wonderful work and the core tenets of the National Voluntary Organizations Active in Disasters, where they talk about communication, coordination, cooperation, and collaboration, really helping to define how you have different organizations from different faiths with different strengths coming together for one common cause and one need. And that's essentially helping people again before, during, and after disasters. There's some partners of the National VOAD that laid out some wonderful principles for people that are seeking to more intentionally and engage with faith communities. One of those partners is led by Peter Gudaitis, who also happens to be the president of the New York Voluntary Organizations Active in Disasters. He's also heading up the National Disaster Interfaith Network. And then you have Bree Lascota from the University of Southern California Center for Religion and Civic Culture. They have developed these 6 principles that for business leaders may make sense as core tenets for good business, right? You want to be able to treat your customers as people first. You're going to be a translator for your goods and services for the things that you're seeking to provide, right? The value you're seeking to create in the community. Making sure that there's strong continuum of connection, not just between peers and employees, but also with vendors, suppliers, and other community partners. And then, of course, making sure that you continue to build trust. And building trust often requires being intentional and consistent over time. And then this other point, which is at the top here, inviting the right people. And so these are some of the fellowship principles that that Bree and Peter have laid out that we want to share with you here. This is available in a one-pager as well. So what I want to do now, though, is actually take it to Kanaya. So Kanaya, when we talk about fellowship in the context of this particular pandemic and this time, I know it wasn't a faith group, but I know that we were able to engage in a particular conversation with dementia, with a chapter of Dementia Friendly America. If you can talk a little bit about who that group is and kind of what that conversation was about and what you learned from that may be relevant to people that may also have employees that are looking to be a resource to one another as they're in a caregiver situation. So you can start with talking a little bit about Dementia Friendly America and kind of what the conversation was.
Certainly. So Dementia Friendly America is a group of advocates, an advocacy organization that spans the country and focuses on the needs of those with dementia and cognitive issues and aging. And the Dementia Friendly chapter that we focused on, or the one that we partner with specifically for this particular training in May, was a group in Prince George's County, Maryland, actually my hometown. But it's important because in this area, it was one of the hot spots at the beginning of the COVID response. And we saw a lot of the spikes in communities of color in Prince George's County as a predominantly Black county. And it was really critical to bring together these intersections, like we talked about, the medical fragility that we see in patients with cognitive needs like dementia, and then the overlapping social needs of those in communities of color that may not have access to the same level of resources and may not be connected to some of those institutions that are supporting in disasters. And that's why we look to community-based organizations like the Dementia Friendly Group, and we look to faith-based organizations as they are often trusted community leaders. In the Dementia Friendly Group, it was really important because we were really joining their chapter meeting and sharing information for the caregivers, the advocates, and the groups that they convene to support those with dementia in the area. So it's about basically leaning on those partnerships to bring information and collate it and kind of translate it for people so they can bring it to their community members.
Thank you for sharing that, Kanaya. And another tidbit about this group. So the introduction to that group was actually through a church. And so Charles had some connections with the African Methodist Episcopal Church, a major church here in DC. And they were able to connect us with some of their membership, which led us to this organization. Why is that relevant to this group? I think you're going to find among the employees that you're working with that you're going to find folks wearing a few hats or maybe being one relationship or connection away from getting pertinent information that maybe your organization is providing out, or can be a provider of information for you to kind of learn and adjust in, right? And so I think that was an example of kind of how the partnership with the faith community and kind of reaching out and seeing how we can make them a success, kind of what their needs were, led to this path for partnership to just essentially provide information, right? And making sure that, again, a caregiver network was able to take care of not just each other, but also for folks that are socially vulnerable or medically fragile. Charles, Kent, doesn't have to be directly related to that story. Anything else you want to add as it relates to some of the core tenets of fellowship, either in this context or how you've seen it manifest in the work that you're leading out on? We can start, Charles, with you if you have anything.
Yeah, real quick. I think it's important to note that faith leaders are among the most patient and versatile leaders that you have, leading these very, in some cases, large, and even if they're not large, just very complex, multifaceted organizations that are like a religious institution or a church. For example, like the AME, African Methodist Episcopal Church as well, which has been around for centuries now. It's the oldest established Black church in the United States and arguably the world. So I think it's important to know that, and we can draw a lot of lessons from that and how they've been operating in an environment like that. These religious leaders having to be patient and deal with multiple personalities, also multiple anxieties. Also trying to figure out ways for people to connect and for people to collaborate, because that's always the mission of a faith leader. The faith leaders just is able to figure out ways to punch through all the politics and the tensions and the disagreements, and for everyone to stay mission focused. And that can be a very useful, that kind of leadership or that style of leadership, which comes very naturally for a lot of faith leaders. I think it'd be very useful to watch and to learn from, but to also utilize when we're talking with business leaders, and business leaders are trying to figure out ways in which they can better interface with these various communities and provide services or product that are essential during these very uncertain times. So just watching that patience, that versatility and that agility among faith leaders. And over the years, as someone also who grew up in the Black church, it's been an amazing thing to watch. And it's something that I've actually learned from over the years in terms of leadership and crisis communications.
Thank you for that, Charles. Kit, anything you want to add?
Yeah, just piggyback. I really like what Charles said, piggybacking off of that. Two thoughts come to mind. One is what you're doing right now as business leaders is full of anxiety and may feel quite lonely right now. And I think acknowledging that, and that faith leaders can be people who give you support, spiritually and emotionally, but they also are going through similar changes and decisions and hard decisions about furloughs and logistics and everything. So I think there can be a connection of leaders there that can be really encouraging fellowship between the business and faith communities. And the thing is just to encourage you, as we see this with fellowship, is to take care of yourself. I think we've on Spiritual First Aid Hub and other places, we with psychologist experts on our team, like our director, Jamie Ayton, to do self-care in the same way we've been encouraging pastors to do that right now. Really encourage business leaders to say, you have to sprint as a business leader right now, but this is also going to be a marathon. And so I think you'll find that the faith communities and faith leaders can be helpful for you in making sure you're taking care of yourself, and that you're able to be there for the pressures this week, but also the pressures 3 months from now and 6 months from now and a year from now.
Absolutely. Thank you for that, Ken and Charles and Kanaya. I think it kind of speaks to kind of that core tenet of we're all human, right? We're all people leading organizations. And I really appreciate you, Ken, touching on that for business leaders. If they're talking to the head of a faith institution, that's essentially that institution's CEO. Now, they may have a board of directors and other challenges as well, but there may be some commonalities in some of the organizational principles and dynamics that they're working through, in addition to, right, how can we make each other successful, what each of our core missions are. So I appreciate you sharing that. So there you have it. You have the different tenets and principles of humility, transparency, integrative thinking, appreciative inquiry, and fellowship, kind of providing a little bit of a roadmap of what it means to act in a crisis. And one of the things that we're hoping that this presentation offered you is a little bit of reframing for how you think about what it means to engage. So that if you look at some of the core tenets of fellowship, and that's again making sure that we're approaching things in a way that's mindful, right? That we're speaking often peer to peer, or leader to leader, through a dynamic or an embracing time, and you're mindful of appreciative inquiry for all that's happening throughout the crisis and crises to come. There always will be some form of asset that we need to keep an eye to, or maybe a North Star on. And as you continue to think through the tensions and really apply some of those principles that were laid out in integrative thinking, and particularly not looking to just the limited scope that you may see right in front of you, but asking the question kind of what's missing that we may be able to provide a solution to, and doing that in a transparent manner. And so, of course, transparency is critically important, and we know that that's one of the key pillars to helping to build trust, along with humility. When you're bringing those 5 components together in everything that you do, not only do you act on faith in times of crisis, but you have the opportunity to keep the faith when you're it. And so for those of you that heard Lenny Marcus's presentation about your you're it moment as crisis leaders, these are some core principles and tenets that I have found to be extremely useful. And I'm incredibly grateful for my colleagues today that have provided some key information and insights on how they are also working in partnership with faith-based and community leaders. Now, there were a lot of resources that were shared. I'm actually going to upload this in the hub after this presentation, so you'll be able to access this tomorrow. For those of you that are in the partnership hub, please register if you have not already, so you can access this. In there, we will drop all of these guides. I want to particularly point out there's a specific resource for people that want to build some systematic relationships with faith-based and community groups, developed by the Department of Homeland Security Center for Faith and Opportunity Initiatives, which is currently led by Kevin Smith, awesome guy from the Salvation Army, also head director of that office. And then we have other resources from Wheaton College, Healthcare Ready, and Council on Communities of Color that we've touched on. And then with that, we have our contact information here. See if we have any other questions from the audience, and we'll go from there. So are there any questions in the chat, Lawrence or anybody? All right. Well, if we don't have any questions, if we can just have final words from, we'll start with Kent, Charles, and then we'll end with Kanaya. So Kent, any final words or encouragement or wisdom that you'd like to impart upon anyone listening to this particular conversation as it relates to partnering with the faith community?
Yes, I'm just grateful for the leadership that you're doing as business leaders. I think you're crucial during this time, and we know your decisions and challenges are immense. So encourage you to reach out and connect with local faith communities to help you, help your employees, and also hope that it can really help to build our communities, that we can stay resilient as we walk through this together with good communication, with humility, and with the kind of vision that Marcus has laid out for us here. So grateful to be with you all. Thank you for what you all are doing.
Absolutely. Charles?
Yeah, a lot of what Kent said, definitely spot on in that assessment. We've all been dealing with this sort of the 3 Ps, apocalyptic kind of 4 horsemen moment, the politics, the protests, the pandemic, and it seems like that. But what's been very encouraging, and we see this with organizations in both the private and the public sector, nonprofit sector, is people acting as community. The more we do that, the better we get through this. And also, the more we find new opportunities on the horizon where we can actually, not just in terms of recovering, but we strengthen ourselves as a society. We strengthen ourselves as a community, as an economy. And that's all very important. And so it's really important there when we're having this conversation. Thank you, Marcus, for having it, because that's what our business leaders in these key, who are also, they're heading up organizations that also provide key essential infrastructure, because then they realize through those collaborations with faith leaders how important community, acting as a community, responding and helping recover and achieve as a community, how so absolutely crucial that is in a really uncertain and seemingly dark time like this. When we act as a community, it all comes together. We're able to see that light, or to reach that light at the other end at the end of the tunnel. So that's why I'm very encouraged by conversations like this, and just looking forward to continue to work with partners like Healthcare Ready and others as we move forward. Excellent.
Thank you very much, Charles. And Kanaya.
Yes, thank you. And I definitely second Kent and Charles' points. Grateful to be a part of this conversation. Thank you, Marcus, for facilitating this and bringing up really a lot of critical considerations when we think about public-private partnerships. I really just want to emphasize the idea of really doing an internal look at your own assets and what you bring to the table, and making sure that you don't necessarily waste effort on creating new partnerships and creating new solutions where there may be organizations in the community you're working for and in that are doing great work. So it's really about bringing something new to the table rather than having to rebuild or recreate the new partnership. So really appreciate this conversation. I thank you for attending. If you're watching right now, thank you.
Absolutely. And I just want to give thanks not only to people that have stuck with us throughout this conversation. We appreciate you for continuing to be part of the Public-Private Partnerships Conference. I want to also give thanks to the staff at the U.S. Chamber of Commerce Foundation and Brooks Nelson, who continues to do an awesome job. And to our panelists, thank you all very much for your generosity and time with folks. I know that we have their contact information here. So you see that top contact line is the Twitter handle that you can follow them on, or their organizations. And then we have email addresses as well. The LinkedIn symbol indicates that you can locate these folks on LinkedIn, including myself. And so with that, I want to thank you all for attending this particular panel session, Acting on Faith in Times of Crisis. I hope that you continue to find new ways and partnerships with faith-based and community organizations to change the world for good. Thank you very much.